schedule. So first, I will identify the anterior border of the trapezius here. Here. This is blob. You see, it makes blob. This is just skin. This is skin and trapezius blob. There is the ventral border. And then I will identify the dorsal border of the SCM. Here is SCM, here is dorsal border, and here between it's an open space. And in this open space I can treat directly splenius capitis and splenius cervicis. Okay. To find where the muscle lies needs to get the reference points. The reference points for the splenius capitis are C4 to T3. I start to palpate C7 and then I go in the middle of C2 to C7. Here it's the middle, it's C4. Or you palpate C7, C6, C4, 5, C4. One finger rests here and then you go again to C7 and you palpate T1, T2, T3, and you know this is origin. With the other hand, you go to processus mastoid, and then you know exactly where the muscle lies. Okay. And here is covered the muscle by the trapezius, but at this part we identified before, I know where the muscle has to be. I can't feel plop, plop, it doesn't work, but I know because I have the reference points, here the muscle has to be. I can go upward to the occiput, there is no splenius capitis, and if I go back, then often you can feel here a little border. This is the border of the splenius capitis. Here I can feel it. Huh? And then I know I'm on the splenius capitis. Most trigger points are in this area and in the upper part near the insertion side. You see the SCM muscles. I can move away, there is no problem. So I can reach very near to the insertion side, and most trigger points for the headache are in this region. It's okay for you?
Yeah, okay.
Okay. Do you suffer headache?
Yeah.
Sometimes? Or
Sometimes.
Sometimes. So I will look for the connection. And you see from our 3 diagnostic criteria, first one I can't notice here. So I start where are sites which are more sensitive. It is every part same, or is it different?
세 가지 진단 기준 중에 타우토 밴드 찾기는 조금 제한점이 있는 근육이라서 어디가 제일 과민화가 돼 있는지부터 찾습니다.
It hurts?
Oh, pain.
Pain. Local pain or referred pain?
Some report. Little report.
Referred a little bit.
Referred. A little bit. Okay. You know the area where the pain arises.
어디서 here maybe?
Yeah. Do you know this pain from
안에
your
어떤 동작이
everyday life?
일상에서.
네, 오늘 아침에 겪었던 두통 비슷합니다.
Yeah, it's similar with the pain in this morning.
Okay. Okay. So active trigger point. So I change to the treatment. Which technique?
뭐죠 테크닉?
No.
1A. 아, 2A, 2A.
Does my finger move or does it not move? Please come closer.
잘 보세요.
투웨이.
Do you feel a movement or not?
movement.
Yeah, he
Yeah.
feels. But it's, have a look. Is it a big or a small movement? Very small. We have to study it carefully. It's a very small movement. You can't see almost. But there is a movement. He feels it very well. Very small and very slow. Then you have the fastest effect. Very little. It rests the pain or does it change?
좀 바뀌나요? 통증 양상이?
네.
Yes.
Yes, what?
어떻게 바뀌나요? 좀
레프트 페인이 지금은 없어요.
no rapid pain. Just
No,
right now.
exactly. It has changed, it has diminished. This is perfect. Okay. This is splenius capitis. Okay. Then splenius cervicis. Reference points are arises from T3 to T5. So I palpate C7, 1, 2, 3, 3, 4, 5. I know from here goes the muscle to the transverse processus C1, C2. Okay, I palpate again C1 here. You see before the mastoid process, behind here the jaw, and then I have an inner vision of this direction of the fiber. Okay, this is very important. And you see here the muscle is under the trapezius, and then at this side the muscle will come on the surface where I can palpate it directly. So I go, as we practice with the levator, I palpate first here the superficial laying trapezius, and then I change, I turn my finger to feel, is there a taut band, is there a fiber I can identify. Okay. This was for demonstration, I showed like this. In my everyday practice, I make it different. I sit on this side. I'm here. I go to the identification, C7, 1, 2, 3, 4, 5. Then I know it's here, okay. I go to this point, and then I turn my finger, I sit to be on the same level, and then I explore, can I feel here the fibers? And now I can feel here fibers, it's made click, click, click. And I am looking, are there 1 or 2 or 3 such fibers? Here I can follow a fiber. And I'm not sure, is this really splenius cervicis, or what could it be also? Exacto, levator. This I don't know at the moment, but it could be. Want you to translate a little bit? Or who needs translation?
필요하신 분 있나요 지금?
Who wishes translation? Or is it clear?
아 괜찮죠 눈치껏.
Because if it's clear, it's perfect. Perfect. So now I can feel here fibers, and I don't know, is it splenius cervicis or levator? So to know this, I release and I go to the levator scapulae. So I make identification of the reference points of levator, angulus superior, and again C1. And you see it's more laterally. I go in this side, trapezius, I turn my finger and I'm looking, and then I feel here the muscle. Boah, and I'm surprised. It's a thick thing here. It's like the little finger. It's blong, 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 blong. And then I go in this direction, and here I feel the thin fiber, and the thin fiber makes bling, bling. Bling, bling is splenius cervicis, blong, blong is levator scapulae. Okay? And so I know now this is levator, and in the dorsal side, next thin fiber, this is splenius cervicis. And so I'm sure in combination to feel both. Okay, very good.
이제 우리가 전에 레베토 스캐플라 촉지할 때도 지금이랑 되게 비슷한 포스처와 비슷한 위치에서 했었습니다. 그래가지고 맨 처음에 이제 로 선생님 이렇게 할 때는 말씀하시기에 근데 지금 이렇게 통통 튕기는 게 있긴 있는데 지금 상황으로서는 레베토 스캐플라인지 아니면은 이제 스플레니어스 서비스인지 확인을 하기가 조금 애매합니다. 그럴 때는 이제 다시 레베토 스테플라의 인설션과 오리진 구역을 찾아가서 한 번 더 확인하고 레베토를 만지려고 한번 해보는 겁니다. 그러면은 아까 만졌던 스플래니너스 서비스에 대한 퉁퉁 튕기는 것보다 레베토에 상대적으로 더 두껍고 더 큰 튕기는 것 때문에 이제 일단 인지가 되니까 그 다음에 다시 조금 더 안쪽으로 가가지고 서비스를 만지면은 확실한 두께 차이를 느낄 수가 있어서 그 두 개를 명확하게 할 수가 있다고 합니다.
Thank you. And now I'm provoking and I'm asking, does it hurt? I know it hurts, it's very international. And then I ask, do you know this pain? Kim, do you know the pain?
No.
No. There is no irradiation?
No.
No. Okay. So I go further and I'm provoking several sites on this splenius cervicis. And here?
Oh.
Oh,
No.
no, not, you don't know it.
No.
You know it?
Yeah.
Okay. It remains local or does it refer?
People.
Refer in which area? Also behind. Okay. And you see I changed probably 1.5 millimeter. It's not a big distance and you have to be very, very precise so to find these points. And then I make the treatment. Which technique? 2A again. You see very small movement. No B because if he starts to move, tack, I'm not anymore on the point. So I have to adjust and here works very well technique 2A. It's okay?
No.
No. So please say stop if it's too much.
너무 아프면 말씀하시고.
Okay. Good. Then the facial separation technique. I treat it now in the area where I can reach the muscle directly. Here are most often the trigger points. This is very comfortable for us. But you can go and look here in front of the trapezius. Can I make this facial separation technique? And so you can reach a part of the splenius cervicis and the splenius capitis as well, where you couldn't reach before through the trapezius. Okay. This is facial separation technique in this position. And then we make the facial stretching technique. It's okay?
Yeah. Okay.
For both muscles, splenius capitis and splenius cervicis.
여기서 두 가지 다 근육 두 개를 한꺼번에 이렇게 3번을 적용할 수가 있고 방금 얘기했던 거 마지막에 얘기했던 거는 트라페지오스가 먼저 이렇게 조금 트라페지오 위에서 간접적으로 치료를 해가지고 전체적으로 이완이 되고 나면은 그 사이에 이제 세퍼레이션 공간이 좀 더 여유 있게 나올 수가 있다는 내용이었습니다.
Okay. So please use these reference points for orientation. It's indicated on the slide.
슬라이드에 나와 있는
Thank you so
기준